Minimally invasive foot surgery sounds great, but is it right for your specific foot problem? My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. While minimally invasive procedures offer amazing benefits, it's not the right choice for everyone. What most people don't realize is that your age, the severity of your condition, and your activity level all play a role in determining whether you're a good candidate. In today's video, I'm going to show you exactly how to know if minimally invasive surgery is right for you, what conditions respond best to this approach, and the key questions you need to ask your surgeon. You'll learn about the benefits and limitations, recovery expectations, and most importantly, how to make an informed decision about your foot surgery. Before we get started, please take a moment to hit the like button and subscribe to this channel with the notification bell. This helps others considering foot surgery find this crucial information, and I post new videos every week with important foot health content. Most patients ask me three questions when they first hear about minimally invasive foot surgery. Is it really less painful? Will I be able to walk the next day? Does it work as well as traditional surgery? These are excellent questions, and the answers may surprise you. You've heard the buzz about minimally invasive surgery, and here's the truth. It's revolutionized how we've approached many foot conditions, but it's not magic. Understanding what minimally invasive surgery actually involves and whether you're a good candidate is crucial for making the right decision about your foot health. Minimally invasive foot surgery is fundamentally different from traditional foot surgery in several key ways. Instead of making large incisions to access the problem area, we use specialized instruments and techniques that require only tiny incisions, often less than a half an inch long. This approach significantly reduces trauma to the surrounding soft tissues. The difference goes beyond just smaller incisions. In traditional surgery, we often need to cut through skin, muscle, and other soft tissue to reach the bone or joints we're treating. With minimally invasive techniques, we can work around these structures, preserving more of your body's natural anatomy and reducing the disruption to healthy tissue. The reduced tissue disruptions typically translates to less pain after surgery, faster recovery times, and minimal scarring. However, these benefits come with certain limitations that not every patient or every condition can accommodate. Common foot problems that respond well to minimally invasive treatment include bunions, hammer toes, bone spurs, Taylor's bunions, and in some cases of plantar fasciitis. The key word here is some. Not every case of these conditions is appropriate for minimally invasive treatment. For bunions, minimally invasive techniques work best for mild to moderate deformities. If you have a severe bunion with significant bone displacement, or you have other foot deformities that need to be addressed simultaneously, traditional surgery might be more appropriate. Hammer toe correction can often be done minimally invasive, especially for flexible deformities. However, if your hammer toe is rigid or there are significant contractures of the surrounding soft tissue, then a more traditional approach might be necessary to achieve the best result. Bone spurs, particularly those on top of the foot, are often ideal candidates for minimally invasive removal. The limited access required and the straightforward nature of the procedure makes these an excellent application for these techniques. The three big benefits of minimally invasive surgery are faster recovery time, less pain and swelling, and smaller scars with better aesthetics. These benefits can be significant, but it's important to understand what they really mean for your specific situation. Faster recovery time doesn't mean you're back to normal activities immediately. It means that compared to traditional surgery, for the same condition, you'll likely be walking sooner and returning to normal activities weeks earlier than you would with a larger, more invasive procedure. The reduction in pain and swelling is due to the reduced trauma to the surrounding tissues. When we don't have to cut through as much healthy tissue to reach the problem area, your body doesn't have to heal as much from surgical trauma. This typically means fewer post-operative medications and less disruption to your daily routine. The cosmetic benefits are particularly important to many patients. Instead of a several-inch scar, you might have tiny marks that are barely visible once they're healed. This is especially beneficial for women who want to wear sandals or open-toed shoes without visible surgical scars. However, not everyone is a good candidate for minimally invasive foot surgery. The ideal candidate typically has mild to moderate deformities, no significant joint degeneration, and realistic expectations about what the surgery can accomplish. If you have severe deformities, extensive arthritis, or complex foot problems that require significant reconstruction, traditional surgery might be more appropriate. The limited access and visualization that characterize minimally invasive techniques can be a disadvantage when dealing with complex problems that require extensive correction. Age can also be a factor, though it's not an absolute contraindication. Older patients with fragile skin or poor healing capacity might not be an ideal candidate. Similarly, very young patients whose bones are still growing might be better served with traditional techniques that allow for more precise control of the correction. Your activity level and expectation also play a role in determining candidacy. If you're a high-level athlete who needs to return to competitive sports, the precision and control offered by traditional surgery might be more important than the faster initial recovery of minimally invasive techniques. When traditional surgery might be better includes cases of severe deformities or arthritis, complex reconstructive needs, and previous failed procedures. In these situations, the surgeon needs maximum visualization and access to achieve the best possible result. Severe arthritis often requires joint replacement or fusion procedures that are difficult or impossible to perform through tiny incisions. The precision required for these procedures typically necessitates larger incisions and direct visualization of joint surfaces. Complex reconstructive procedures such as those needed after trauma or for severe congenital deformities often require the surgeon to work on multiple structures simultaneously. This level of complexity is difficult to manage due to limited access provided by minimally invasive techniques. Previous failed procedures can create scar tissue or an altered anatomy that makes minimally invasive approaches more challenging. In these revision cases, traditional surgery often provides the best opportunity for a successful outcome. What you can expect during and after minimally invasive procedures differ significantly from traditional surgery. Recovery timeline varies depending on the specific procedure, but most patients can expect to be walking in a protective boot within days rather than weeks. Return to normal shoe typically occurs within 4 to 6 weeks compared to 8 to 12 weeks for traditional procedures. However, it's important to understand that walking sooner doesn't mean healed faster. The underlying healing process still takes time, and pushing too hard can compromise your results. The key is that you can be more active during the healing process while still protecting the surgical site. There are several common myths about minimally invasive surgery that I need to address. The first is that it's just a cosmetic fix. This couldn't be further from the truth. While the cosmetic benefits are nice, the primary goal is always to relieve the pain and restore function. Another myth is that minimally invasive means it's not real surgery. These procedures require the same level of surgical skill and precision as traditional techniques, often more so because of the limited visualization and access. Some people believe that these techniques are only for elderly or inactive people. In reality, many of my most active patients choose minimally invasive options specifically because they want to return to activities as soon as possible. So how do you know if minimally invasive surgery is right for you? Ask yourself 3 key questions. Is your condition affecting your daily life? Has conservative treatments failed to provide adequate relief? Do you want faster healing and less downtime? If you answered yes to these questions, you might be a good candidate for minimally invasive surgery. However, the final determination requires a thorough evaluation by your surgeon who's experienced in these techniques. How to take the next step involves booking a consultation with personalized surgical evaluation. During your first visit, expect a comprehensive evaluation of your feet, discussion of your symptoms and goals, and review any previous treatments you've tried. Your surgeon should explain all the options, not just the surgical ones, to help you understand the pros and cons of each approach. If you found this information helpful, please share this video on social media. Your simple share could help someone make an informed decision about their foot surgery options. Also, leave a comment below if you have any questions about minimally invasive foot surgery. I do my best to respond. If you're considering foot surgery and want to know if minimally invasive techniques might be right for you, schedule a consultation for a comprehensive evaluation. We can assess your specific condition, discuss all your options, and help you make the best decision for your foot health. The link to schedule is in the description below. Thanks so much for watching, and have a great day.